This presentation is on the Sound Marital House, Dr. John Gottman's research and treatment suggestions. I'm Lynn Maynes. I'm with the Evaluation, Development, and Training Department of LDS Family Services, and I welcome you with us today. For the last 30 years, Dr. Gottman has been observing, or as he calls it, plagiarizing from couples. He watches couples in very minute moments and codes their behavior. And over the years, he's been able to observe behaviors that contribute or detract from the quality of the marriage. And he, along with a few other researchers, have now developed a model that will help us improve our marital therapy. Clinicians are very creative, combining art and science to help people and providing a safe atmosphere to help them change. However, despite all of our best efforts, we still have a very pervasive problem in our industry, and that is of the chronic relapse of most of our clients 2 years post-treatment. Now, this workshop is going to present a model of helping clients based on two aspects. First is changing the way that they resolve conflict, and the second is in building a stronger marital foundation. His model considers three things: interactions, how they interact with one another, their perceptions and beliefs, and then their physiology. This model puts therapists in the role of educator, coach, and facilitator. Our workshop goals this morning are: first, we're going to review the research findings on marriage, and Dr. Gottman calls them the disasters and the masters, people that do things really well and then people that are pretty clumsy in their marriages. We're also going to discuss the treatment model and the assumptions that he has that go along with that treatment model. We're going to review the assessment methods that he recommends. We're going to overview the principles that we need to teach our clients as we work with them, and also the treatment goals. And then lastly, we're going to look at Dr. Gottman's own treatment approaches. I love this picture of this couple. If you look at them on the slide, you can see that they're both staring at us with those eyes, looking at us rather suspiciously, tired, hurt, upset, and they're looking at us saying, "Please fix my partner." And they can be communicating vague concerns such as we're having marital problems with communication, or we might be having problems with infidelity, substance abuse, lack of trust, value conflicts. Couples are often demanding that their partner change, and they're focusing on their partner's weaknesses. They come into counseling hoping that we as counselors will see their partner's faults and be able to change them, and at the same time that we will see their faults as very minor and somewhat charming. And so they focus on and do not believe they can be happy unless their partner makes the changes necessary. Now, this sets up a very destructive cycle in their marriage. We need to see past the presenting problem and be able to target interventions at places that research has found that is most helpful. So on the next slides, we're going to start looking at different things that John Gottman has identified in his research, and each point that we identify can become a future intervention to use with our couples. Now, he calls these the disasters, as I said a moment ago. These are the problems that marriages develop that we as clinicians want to be watching out for. The first one is negativity. There's more negativity than positivity in daily interactions. And what this means is, and if any of you remember seeing some of your clients who are really in trouble, it seems like their interactions are like 4 negatives to every 1 positive. But in reality, a couple that's going towards divorce is really about 50-50. They're just about equal in positive and negative interactions. But that is a serious problem. Now, in the masters, or in marriages that are going very well, the ratio is 5 positives to every 1 negative. And so as clinicians, we are always going to be looking at how to improve the positive to negative ratio. The next one on the slide is negative perceptions. These are the negative beliefs that couples begin to form over time. They begin to think that their partner is doing things intentionally to hurt them, or that their partner is being selfish and not considering their feelings. They also, and I'm sure probably many of you have seen this, they will begin talking about the history of their marriage in negative terms. They talk about how maybe they weren't really in love when they got married, or that they were going to move out of state and they thought they'd just go ahead and get married. But generally there's a negative change in the way they describe their courtship and their marriage, and that's part of the negative perceptions. The third thing that's very important in marriages is that men, and this is a statistical thing, men rehearse distress-maintaining thoughts. And so men think about these things that are upsetting them over and over and over again, and that contributes to the negative perceptions in the marriage. The third on this slide is failure of repair attempts while fighting. This is a correlate of whether or not a relationship has a positive or negative overtone. When people are fighting, they escalate, and generally they try to calm one another down, or they try and change the topic. And in distressed marriages, those repair attempts are failures. They don't work. Versus in a marriage that's non-distressed and the couple is fighting, they deliver a repair attempt every 3 minutes, and it's able to maintain the tension at a certain level, at a manageable level. And so failure of repair attempts while fighting is very important to realize and to observe. Other disasters is a continued escalation during conflict. They can have a quick escalation, very explosive with increasingly hurtful and destructive dialogue, or probably some of you have seen couples who will have what I call marathon fighting. The fighting will go on for hours verbally, or they won't speak for days. And that's a continued escalation of tension and conflict, and it's a disaster for the marriage. The next part is failure of men to accept influence from their wives. From a statistical standpoint, even though I think many of us have experienced this in our own lives, when you suggest something to a man, it's hard for them maybe to take direction. And we've found that in marriages that are non-distressed, men can kind of hear the wife's complaint and accept influence from her, versus in distressed marriages, men get very upset in response to that. And so failure of men to accept influence is a really important thing that we need to educate our clients about. And then gridlock fighting over the perpetual problem. Most fighting done by couples is over the same issue. It comes up in a variety of scenarios, but underneath that scenario, it's the same issue. And they will fight about this for years and years and years. And in distressed marriages, they get into a gridlock pattern where they just dance around the topic, increase their negativity, don't resolve anything, versus in non-distressed marriages, these perpetual problems keep coming up, but the partners are able to accept the other person's position and figure out a way of working with them and working around the perpetual problem. Virginia Satir called this the big game of life, where each of us get into a polarized position and we want our partner to change on something, and they're not going to change. And so we want to help our clients to understand that in perpetual problems, resolution is not the answer, but regulation of the intensity. Now, some of the perpetual problems that you might see would be closeness versus intimacy, spontaneity versus being logical, spending money versus saving money, keeping secrets, being open about secrets, anger should be expressed, don't express anger, a clean house versus a lived-in house, a successful career versus a laid-back lifestyle, work first versus family first. These are all gridlock problems. In this picture you can see on the screen, I love this picture because it shows a pattern of mismatch in demand withdrawal, which is there are avoiders in life, there are fighters in life, and there are validators in life. And when they're married and we have two validators, it works very well. But if we have, for instance, an avoider and a person who wants to fight, that will create a huge problem in the marriage. And this picture reminded me of many cases I've had where one of the partners is running away from the fight, trying to get out of the fight, and the other person is hanging on for dear life, chasing the person around the house, trying to keep that fight going. It's a disaster. The next one is failed bids at emotional connection. Every day in a couple's life, there are hundreds of opportunities for the couple to join together in little connections. And usually what we do in a marriage is that we'll throw out a bid for attention or affection or conversation in a very indirect way because we're afraid of being rejected. So we'll throw out some little bid. And in distressed marriages, those bids are ignored or demeaned. Versus in successful master marriages, those connections generally are received by the partner in a positive way. And out of all the things that we can be watching for and wanting to build in our family, in our couples work, is the failed bids at emotional connection, getting those bids to be more successful on a daily basis. Next, under disasters, we have emotional disengagement. When you see a couple come in, you might observe things like a flat affect or little affection, little humor. They don't appear to be close friends. One thing that they also might do is apologize for their complaints or not feel entitled to their complaints. They also will be very tense, and I think that you can usually observe that in the session, the tension between the couple. And while they're sitting there fairly tense, they do little to soothe one another. And this emotional disengagement is that they have pulled apart and they're no longer taking care of one another. The next part that goes along with this is emotional flooding. One of the biggest problems in marriage is men get flooded emotionally. They get overwhelmed with their emotions much more easily than women. That might be a surprise, but they do. They get overwhelmed. And when they feel flooded, they tend to react in a belligerent way or in an angry way, but eventually they begin to isolate more and more. And Dr. Gottman calls this the cascade to isolation. And in 1992, California did a research project with mediation and couples that were getting divorced and going through the mediation process. And in something like 83%, they all reported that the disengagement and the emotional isolation was the cause for the divorce. Now, I believe that prior to the total emotional disengagement, there probably was some infidelities of various sorts. But the isolation is a very serious problem, and therefore the flooding is a really important problem that we need to address with our couples and help figure out how to overcome it. Chronic diffuse physiological arousal. This is a really interesting statistic. In distressed marriages, people have 17 beats per minute heart rates greater than people who are in non-distressed marriages. And so people in distressed marriages are going through a chronic state of hypervigilance where their heartbeat is actually elevated. And what's also interesting is if you test their children within 24 hours of a marital conflict and do a urine analysis, their adrenal levels are also elevated. And so families are in a chronic state of arousal, and that's a really negative thing, and so we want to look at that and work on it. Now, Dr. Gottman, taking all this research that he's done, he essentially started his career as a mathematician from MIT. And so all his observations of couples have been coded, and then from there he does statistical analysis of them. And he developed this sound marital house. What I like about this model is that you can take the very most basic parts of it and apply it in your practice, in your style, or you can take it and move along into more advanced stages and work with it within your style and help your couples in a much more effective way, remembering that we're trying to prevent the chronic relapse of our couples. He does focus on the behaviors, the perceptions, and the physiology in the couple. And he highlights 7 components that marital treatment interventions can target. Now, this slide is his model of the sound marital house. And what he does is he starts at the very first floor, and if you'll look at that, he calls it the love map. This is the cognitive room that people have for one another. How much do I know about my partner? How much do I know about their day? How do I know about their worries, their stresses, their dreams, their goals? What do I know about my partner? And as we build our cognitive maps for these couples, they're able to form they're able to form a better friendship. And that's where it starts, is making room for caring and listening to their partner. The next level is the fondness and admiration system. In masters couples, they care about one another, they're kind, they're respectful, and they admire their partner. In distressed marriages, that is often lacking, and so we want to build the fondness and admiration system with our clients. The next floor is the turning towards versus turning away. And this is the emotional bank account of the marriage. And it goes back to these bids for connection. If the bids are being put out there and being received, it brings in tons of money into that emotional bank account that carries through when the couple has conflicts or problems. And so it's very critical that we help our clients learn how to turn towards versus turning away during bids for connection. The next floor is the positive sentiment override. That means there's a positive tone in the marriage. And this 4th floor is a bonus floor. I like that. You get it to build it for free, because if you have the first 3 floors in place, your marriage has a positive sentiment, and it just will carry the day through all the problems. So it's critical that we get those first 3 floors, and then that 4th floor just comes in. The 5th floor is the 4 parts of effective problem solving. And I'll just give those to you, and I'll read them slowly if you want to write them down. The first one is soften startup. Women usually begin discussions, and so women need to learn how to approach their husbands with the problem with a soft startup. Women are the relationship managers, as I call it. They are the ones that usually bring up the intimacy problems and the wanting to talk about things in their lives. And so if they can learn how to do that in a non-aggressive way, it's very, very helpful. The second skill is the repair attempts. Both partners need to be working on modulating the tension in the argument and keeping the conflict de-escalated to a comfortable level. The third is accepting influence, which I've talked about already. People need to be able to accept influence from their partner when they're resolving a conflict. And the fourth is compromise. There has to be a compromise somewhere in any solvable problem. Now, these behaviors then allow for a dialogue over perpetual problems. These same problem-solving skills contribute to the physiological soothing which needs to occur during any discussion. And so then we can start talking about the perpetual problems that don't go away using the same skills, but understanding that we're probably not going to resolve a perpetual problem. The next floor is making dreams and aspirations come true. Couples are able to hear their partner's position, their underlying dreams, fears, and they're able to honor their partner's beliefs rather than get into perpetual marital gridlock. I'll tell you a quick story here from Dr. Gottman's life. His wife, Julie, had a life dream of going to base camp at Mount Everest. He did not want to participate in that at all. He doesn't like heights. He had no interest. And for a while, they were in a gridlock over this because she wanted to go to base camp before she turned 50. He started thinking about his model and how do you work with a perpetual problem, because this had been a dialogue going on between the two of them for several years. And so finally he came to her and he said, this is what I can do to honor your dream. I can help finance the trip for you to go to base camp. And when you call me home from your trip and I'm at home, I won't whine about how bad it is at the house. And I won't whine about how I need you here. And when you get back from the trip, I will read one book on Mount Everest. And that's all she needed, was that much of him honoring that much of the dream, doing what he could so that she was able to make her dream come true. And we need to help our couples look at what part of those dreams can we honor, and it will so much contribute to the well-being of the marriage. The attic portion of the house is the creation of shared meetings in a culture of the couple and in their own nuclear family. Regardless of the backgrounds of the partners, they come with different cultures. And so we need to help them build their own rituals, their own stories, their own value system that's a harmonious one to create this total package for them. Interestingly, when we have that addict system going and we're sharing beliefs and we're creating rituals and stories, it flows back down to the very first floor, the love map, and it just carries through to create a positive sentiment override with the couple. Now, some treatment assumptions I'd like to refer to from Dr. Gottman. I have a joke here because I many times think about clients coming to see us and how very, very hard it must be for them to come. First off, we know that it takes on an average of 7 years for a distressed couple to get to see a marriage therapist. We also know that of all the couples that get divorced, only 1% come to see us. So it is a very scary thing and overwhelming for people to come to see us. And I've thought of in my life what's like the most scary thing is going to the dentist, and I tell my clients that often. And this little joke here is a joke about a dentist because it just goes with how scary it is to come to see a therapist. And the woman says, Dr. Vernley prides himself on his commitment to 100% organic dentistry. Today he'll be using bamboo drill bits, yucca extract painkiller, and adobe fillings. Our interventions should have low psychological cost. If they don't, we will encounter resistance. And so we need to make therapy a positive experience, that when the couple leaves, they feel hopeful and that they haven't had to take tremendous risks in the therapy or go through some tremendous ordeal. We want it to be a good experience for them. Other treatment assumptions is the concept of the good enough marriage. Nowadays, or at least in the past decade, has been quite an era of narcissism. What's in it for me? How can I take care of myself? How can I fulfill myself? And it turns into, have I married the wrong person? Or our family saying, you could have married someone better. And that kind of thinking often contributes to the idea that we have a bad marriage. Now, often people also expect marriage to fix all their emotions, and this is not a realistic expectation of marriage. Frank Pittman, who I enjoy, made these statements. He said, marriage commitment is the promise that makes life coherent, and we need to make the assumption that marriage is supposed to work. And so when we see a couple coming in and they're highly distressed, we can make the assumption that marriage is supposed to work. In the LDS faith, we also have proclamation to the world, which reinforces the idea that marriage is supposed to work. And so as a therapist, I have to take a stance on this. What is my belief system about divorce and staying together? And what is the good enough marriage that's a satisfying marriage? The next treatment assumption is making the therapist obsolete. Because our greatest challenge is the chronic relapse of our clients, we need to figure out a way of delivering services so that at the front end we're highly involved, but at the end we're obsolete. Our clients are coming in and don't even need us. And at home, they don't need a therapist. They're doing the things that we've worked with them on, and we're no longer needed. So making the therapist obsolete is one of our assumptions. We also make the assumption that emotion is useful and okay in treatment. So when we see someone with emotion, we're able to work with that, comment on it, and it opens doors to communication, and it unlocks secrets that people have wanted to share but have been afraid to share, or they share their dreams with us. And so using emotion is a very effective tool in our interventions and in our treatment sessions. Also, emotion is useful in using it in the process because it slows things down. If you've noticed that couples, when they're agitated or fighting and not paying attention to emotion, the interaction goes very quick. But as a therapist, if you intervene or you teach the couple how to intervene and start talking about their emotions, it slows the process way down, and it's a very effective tool and very positive experience overall for the client. Also, very critically is that the therapist's job is not to keep people calm. Rather, it's our job to teach them how to keep themselves calm. This is part of Dr. Gottman's treatment when he sees clients, as he has them strapped up to heart monitors, and they're very aware of how upset they're getting, and when that heart rate gets going at a certain point, they know that they have to stop and calm down, and they teach themselves how to do that. And so as therapists, we're going to facilitate teaching the soothing of one another when they're upset. Now on intake, on the intake assessment, each of you probably have your own style when you meet with a couple. I generally join with my couples by hearing their stories a little bit at the beginning. I do a genogram always as part of the beginning session, and then I hear their stories. And as I hear their stories, I join with them and I try and gather information. In addition to that, we need to be aware of the history of the relationship, and there's a lot of questions. I'm going to go through some of the questions. Since I don't have a handout, I've written down the questions that you might want to make note of. You want to start when they met and get as many details as possible. Their dating, what attracted them to one another, the highlights of their dating, tensions, How did they make the decision to get married? Why this person? Were you ever in love? What do you remember about your wedding, your honeymoon, your first year? What adjustments have you made over the years? What moments stand out as really happy times? Were there any ups and downs? What stands out as hard times? Why have you stayed together? How did you get through those hard times? What's your philosophy about getting through difficult times? How is your marriage different now than it was in the beginning? So we want a pretty comprehensive history of the relationship. Next, we want to get the philosophy of the marriage. And this is a really good intervention to take with the couple. Here we're interested in ideas about what makes marriages work. Why do some marriages work and some don't? Ask your couple to think of two couples, one that has a good marriage and one that has a bad marriage. Have the couple decide together on those two couples they want to identify. Then ask them, what are the differences in the marriages of those two couples they've identified? And how would you compare your own marriage, pros and cons, to each of those marriages? It's a very good intervention to help remove them from the immediate problem and help them compare and contrast to see their own strengths and see where they can work. We also want to know a little bit about their parents' marriages because that really contributes to the philosophy of marriage, their own marriage. On the intake assessment, we want to know where they are each in the marriage. What is the commitment level in the marriage? What is the nature of the marital friendship? What is the nature of the sentiment override? That's what I talked about, was the tone of the marriage. Is it positive or negative? What's the nature of conflict between the couple and its regulation? What's the nature of their life dreams and their shared meaning system? And what are the potential resistances that might exist? We can begin, I always start with a conjoint session with the couple. And then if they request, I can see them individually one time. But most of my work is done with both of them in the same room. Marital treatment is contraindicated when there is an ongoing marital affair, if there's ongoing abuse. And in my own practice, I have found that if there's one partner that has totally checked out of the marriage, that marital therapy might not be helpful. I worked for 3 years with a couple where the wife was totally checked out, but the husband was still in. And they kept coming for treatment every week. And I would send them home with the homework assignments, and we were doing John Gottman's model. And every week the wife would come back and say she hadn't done her homework. She appreciated what her husband had done, but she didn't care anymore. And after 3 years of a lot of work, they decided to divorce. So I'm a little bit at that point that if someone has really checked out, it's hard to get them to recheck back in to the marriage. But you want to observe as you work with the couple how they're sitting, how they're looking at each other, are they touching one another, what kind of affect, do they have a sense of being a team? And if they do, where? Maybe as parents even they could have a sense of being a team. How much do they know about their partner, that love map, cognitive room? How much negativity, chaos, or disappointment is there? Do they have a chip on their shoulder? Are they hypervigilant against attack or defensiveness? Now, remembering the marriage disasters and the masters, you can observe what's going on with your couple, and you can begin making interventions in those very specific places. I also wanted to refer you to 2 of John Gottman's books, Why Marriages Succeed or Fail and How You Can Make Yours Last, and the second, The 7 Principles for Making Marriage Work, a Practical Guide. In those books, he has many, many assessments, self-assessments that the clients can do. I ask my clients to do many of those assessments as homework and bringing them back to me, and we discuss them. And they're just available in his books, and they're very good. Also, as part of the assessment, you might want to use the revised dyadic adjustment scale, or the Locke-Wallace marital adjustments test, or the Weiss-Serrato marital status inventory. Those can also give you good information on assessment. Now, at the very basic level of this model, this is where we want to put most of our energy and understanding. So the most effective marital therapy treatment focus is first. We want to increase everyday positive affect. So from the very beginning, we're going to start working with the couple to help them build and rebuild their friendship. Yesterday I saw a client and she said, "I have never felt like my husband was my friend." And I thought to myself, yippee, because that means we're going to start right here of trying to build this friendship. The second is we're going to reduce negative affect during the conflict. So we want to know exactly how they're fighting and what can we do to help them so that the conflict does not get so destructive. And the third thing is increasing positive affect during conflict. So while we don't want to get too negative, we want to be interjecting positive things. Dr. Gottman says that if we cannot do anything else, if we can remember those 3 points, we can improve our marital therapy and perhaps have fewer relapses with our couples. I want to quickly go over the principles to be taught. These are principles that I give to my clients. They're the ones that I learn and I want them to learn. So they're just principles that we use as part of our interventions. So the first principle, repair attempts need to be used during and after conflict. They have to learn that they need to calm one another, take breaks, whatever it takes to repair feelings while they're discussing something. Another principle is the bids for emotional connection need to be met with positive responses. So if I go to my husband with some indirect bid for connection, he needs to learn to respond to me in a positive way. Third, an atmosphere of caring and fondness must be cultivated. That means they have to work in their home, in their lives, to bring that ratio of 5 positives to 1 negative. And if they can do that, this marriage is going to be a success. Another principle to be taught is that regulation of conflict, not the resolution, is most important. 69% of all conflict is perpetual conflict. And so many couples go around in circles thinking that they're going to resolve this perpetual problem, and they're not. 31% of the problems are fixable, but 69% are not. So we need to teach this completely different way of looking at conflict, where we want to regulate the intensity, the negativity, the positivity, but not worry about resolution that much. And that the man's role is critical in accepting influence from his wife. And I print these up for my couples, and I give them to them, and we discuss them. Maybe not all in one session, but we definitely discuss them. Principle to be taught. De-escalation of negativity during a conflict is important. And statistically, the husband's role is critical in this, which means that when the wife presents him with an issue, he needs to not match her in negativity or even escalate his negativity or get defensive or belligerent. It's his role to de-escalate the negativity in the conflict. And interestingly, the opposite is that during the conflict, statistically, it's the woman's role to keep trying to have positive statements and positive affect during the conflict to de-escalate behaviors and emotions. And you might think, well, why is the husband's role this or the wife's role that? It's because Dr. Gottman has coded thousands of couples and has seen what works. And so these are the things that work. And so the wife needs to make soothing statements and trying to keep things calm, and the husband needs to try to not be negative during the conflict. The principle to be taught is behavior exchange, non-conflictual, take place frequently and are not give to get, but give to give. This means that we want couples to be doing nice things for one another with no purpose in mind other than their fondness and caring, and they're just being nice and doing. And yesterday in our couple session, the wife said, well, what if I don't feel like doing that? And my co-therapist said, well, then we have to act as if. And so we encourage couples from the very beginning to start giving just to be giving. And we teach that principle. I now want to go into treatment goals. All these things are the basis for your interventions. Principles to be taught, the disasters, everything are interventions. Now the treatment goals. Number 1, the couple can process failed interactions and are able to make their next conversation better without the therapist. According to John Gottman, we need to drop the active listening approach. When I have presented this concept in the past, people have not agreed with me, but John Gottman has done quite a lot of statistical analysis on this. And he says that active listening was designed to increase empathy. The active listening model is so prominent that it's become a major component in every major school of marital therapy. However, several studies have now found that this intervention only decreases negativity, it doesn't increase positivity, and then there's a quick relapse. It doesn't hold up when the couple leaves therapy. And so, in fact, Dr. Gottman says if you don't do anything else, drop active listening as approach during your treatment. It is not helpful. So we want to teach problem-solving skills for the solvable problems, such as communicating without blaming, giving appreciation, accepting influence, stating one's needs clearly, compromising, negotiating agreements. The next treatment goal. The couple can soothe and self-soothe during conflicts and failed bids. Once again, we need to teach our couples to recognize physical symptoms, the first red flags that they're getting upset, and help them devise strategies and ways to experiment to help them calm themselves and to calm one another. And this is a critical piece in the treatment. In therapy, I typically keep a very calm atmosphere, and I'm doing a lot of different things to keep the atmosphere safe and calm. And now I'm trying to shift where I'm asking them, what could you do right now that would help you calm? Or is there anything you'd like to say to your partner that perhaps could calm them or soothe them? Third treatment goal is the couple will improve the marital friendship through homework exercises. In these homework exercises, the first one is the 5-to-1. I never have a couple leave my office that I don't say, remember the 5-to-1. 5 positives to every 1 negative, and we will have a wonderful marriage. But also we want to change 5 hours of the week for them. And here's how we like to suggest that they change. 2 minutes a day times 5 working days. When you leave one another, you take 10 minutes to part. For reunions, when you come back together, 20 minutes a day times 5 days a week, that's an hour and 40 minutes a week. You take time to find out how one another's day went, what stressors, what went well, just a little bit of time together. Admiration and appreciation, we take 5 minutes a day times 7 days a week. That's 35 more minutes. 5 minutes a day, just say some little things that are showing admiration and caring and appreciation. Affection, another 5 minutes a day times 7 days a week. equals a total of 35 minutes. Just being kind and affectionate. And then we have 2 hours a week where you go on a date or where you talk and learn about one another, increasing your cognitive room, your love maps for your partner. And that will give you 5 hours of improved interaction as a couple. The fourth treatment goal is the couple can dialogue with perpetual problems and not be gridlocked. When we hear couples in a perpetual problem, we have to help them look for the underlying message and dream and fear, and we have to figure out a way to encourage insight into the problem. Now, some of us are better at that than others, but my experience has been if I take the time and I keep the process pretty slow, that I can hear the underlying message that's going on in this problem. We want to emphasize safety and the meaning of accepting our partner's dream and how to honor the partner's dream. We can use the emotion, as we've already talked about, to help unlock this information. The fifth goal is formal and informal rituals of emotional connection are devised. So we want to help the couple come to agreements on ways to emotionally connect, build rituals to facilitate those connections. We want to encourage them that when they leave one another, that they say goodbye, that they kiss goodbye, that they make it a meaningful moment. Also the reunions that we've already talked about when they come back and join during the day. Meal times are very important. And often at mealtimes, parents are the ones that start negative interactions. So we want to help educate them that we want meal times to be when we share the events of the day, each person gets a chance to talk, and the environment is one of peace and affection and support and attention. We also can encourage them to go on dates and eat out and build rituals and stories in their family life that will build the emotional connections. After mealtime, have the family and the couple put away the dishes and clean up, and they can talk and be together as a couple. After the children have gone to bed, parents can take an hour and talk to one another in a quiet time. So there's a lot of different ways, and we have to work with our clients to come up with what will work best for them. The sixth treatment goal is the rudiments of shared meaning and shared value system is in place. One of the biggest problems that I think couples face today are the stressors from outside the marriage and prioritizing the marriage versus work. And so as therapists, we need to really be alert to that and help couples figure out ways to buffer their marriage from these outside stressors. I've worked with many couples that have been involved in the airline industry, and that means that pilots leave for days and they come back for a few days and then they leave for days. And when they're home, they try to crowd all their life into those 3 days, and it's very, very stressful. And it's learning what can we accomplish during those few days that the husband is home, and what's reasonable and what's important to this family. We also need to think about the spiritual values. What does it mean to be a good LDS member? Couples don't always agree on that. What's the meaning of religion and God in your lives? And what is your common ground? And in a good enough marriage, we figure out what is the common ground for this shared value system. Now, as I said before, all treatment goals are the basis for therapeutic interventions and homework assignments. So between the treatment goals, the principles to be taught, the disasters that you're going to be watching for, they all are the basis for the homework assignments. I want to just briefly go over John Gottman's approach. For him, assessment is very critical. He videotapes all his clients. They're all taped up to heart monitors, so he knows exactly what's going on with them, and he has extensive interviewing. He also is a very good observer through all his coding of the couple, and then he gives them lots of questionnaires So that within the first 4 hours of working with this couple, he really knows the couple. And that's his method of working with them. He also begins treatment with lots of therapy. He will see them for longer than an hour a week. He will do whatever he needs to do to help them at the beginning of treatment. But over time, because of the relapse rate that he's trying to prevent, he is going to fade out. The couple is given lots of homework. Every session, a couple leaves with their homework assignment that they're going to do and come back and report. And if it doesn't go well, that's fine. We just want to hear how it went, and we will then process that. And then after you've faded out, we work on having periodic check-ins to help prevent relapse. I often have people come in every 6 months, and then I've had couples come in annually. And they kind of write up an annual contract of things they're going to work on for the next year. And it's been very successful. Let's see here. The next one is, if conflict is resolvable, we want to teach and coach the skills, which we've talked about. If it's resolvable, we're going to work on that. If the conflict is perpetual, we're going to facilitate the understanding of what Dr. Gottman calls the dream within the conflict. When that perpetual problem is happening, if you can help the clients unlock that dream and talk about it and share it with their partner and have their partner hear it, it's a very powerful intervention. It doesn't fix things long term, but it starts the therapy process, because it might be one of the first times in their lives that they've actually been able to share that dream that's underlying that perpetual problem. And Dr. Gottman believes it's very important to bring out those dreams that are part of the perpetual problems. I have to quickly tell you about his treatment approach in his office. He has a very small office, and he has it divided into 2 parts. One part, which is in front of the video camera, he calls the boxing ring. And then behind the video camera is the corner. And so what he does is he has the couple go into the boxing ring part of the office and discuss a non-resolvable or perpetual problem for about 10 or 15 minutes. And he instructs them that they're not to try to resolve it, they're just to talk about it. And so he watches them for about 10 or 15 minutes. And then he calls them out of the ring. Just like a boxing match, he calls them out of the ring, and he coaches them in the corner. And he coaches both of them about the things he's observed then, what he knows about them in the past. He makes suggestions. Then he sends them back into the ring to re-talk about the same problem. And he's been able to successfully get people to remove the gridlock from the problem and dialogue. And he enjoys that approach, and you can see if you can implement that. And in closing, I just wanted to reiterate the 3 most effective therapy treatment focuses. We want to increase everyday positive affect, which means their friendship. We want to reduce negative affect during conflict, and then we want to increase positive affect during and after conflict. If we can do those things, we're going to reduce our relapse rate of clients, and our therapy will be significantly better. Thank you.